Hello, Ms. Jones. What brings you here today?
Hello, doctor. As I told your assistant, my symptoms began 3 days ago with mild fever, fatigue, headache, muscle pain, sore throat, and runny nose, but they are getting worse.
Yes, Sally told me. Sally, do you have Ms. Jones' vitals?
Yes. Her oral temperature is 38, but her vitals are otherwise stable.
Well, these are the symptoms of the common cold. Did you know that common cold is the most common infectious disease in humans?
I didn't know that. So, that's why this winter everyone I knew has already had a cold. Is there a vaccine that we can get to protect us against the common cold?
Unfortunately, there is not a vaccine that can protect you against the common cold, for two reasons. First, there are more than 200 different viruses that can cause this disease. Second, these viruses undergo genetic mutations every year, which change their characteristics.
It means that, even if we had a vaccine for the common cold, the last year's vaccines were no longer effective in preventing this year's common cold epidemic. Am I right?
Exactly. That's why producing cold vaccine is not practical.
So, is there any other effective preventive methods for reducing the chance of catching a cold?
Yes. There are two main preventive measures that can significantly reduce the chance of catching a cold. First of all, you have to avoid close contact with those who show the symptoms of respiratory infections, such as sneezing, runny nose, and nasal stuffiness. And secondly, you have to wash your hands thoroughly and frequently before eating, or touching your eyes, mouth, or nose, especially during the cold season.
Sometimes when you are out, you don't have access to soap and water. For example, when I'm on a bus, how should I clean my hands?
May I answer this question?
Yes, of course, Sally.
When you don't have access to water and soap, you can use an alcohol-based hand sanitizer. They are very effective in preventing the transmission of most cold viruses.
Thanks, Sally. That's completely true.
Is there an effective treatment for the common cold?
Unfortunately, we cannot treat this illness. All we can do is to reduce its symptoms to make them more tolerable. There are many different over-the-counter cold medications that can reduce the symptoms, but they neither reduce the length of the symptoms, nor prevent its transmission. Oh, by the way, I recommend a topical decongestant spray to keep your nose open. Just make sure that you don't use this spray for more than 3 to 5 days in a row.
May I ask a question?
Of course. What's your question?
Why we should not use these nasal sprays more than 3 to 5 days? What happens if we use them longer?
That's a very good question. If you use these sprays more than 5 days, they will worsen the nasal obstruction, and you won't be able to breathe normally through your nose.
Do you mean that the nose becomes addicted to the topical decongestant sprays?
That is exactly what happens. By the way, make sure to rest adequately, and drink a lot of fluids. Steaming is also very helpful in reducing your symptoms.
Should I come and see you again for my cold?
No. It usually lasts for 1 week or so. The symptoms gradually increase during the first 2 to 3 days, and reach their peak in 3 to 5 days, then they start to abate. Having said that, you have to call my office if you develop high fever more than 38 degrees centigrade or your symptoms don't get better after taking the medications I've prescribed.
Do I need prescription medications?
No. Not at this time. I'll write the names of the cold tablets, nasal spray, and a cough syrup to make sure you don't forget their names.
What about antibiotics?
As I mentioned before, this is a viral infection, and antibiotics do not affect viruses. We only use antibiotics for bacterial complications, such as bacterial sinusitis. One more thing before you leave. Don't forget to call Sally if your symptoms persist more than 10 days.
Yes. Just give me a call, and I will do my best to fit you in.
Thank you so much. I really appreciate it.
No worries.
Okay. Thank you, doctor.
You are very welcome.
Goodbye, Miss Jones.
Goodbye, Sally.
Oh, Sally, I forgot to tell her that she can find additional information about the common cold on CDC or WHO websites. Could you please call and let her know?
Yes, of course. I'm calling her right now.
Thanks, Sally. Let's go see the next patient.
No worries. I'll join you in a minute.